I'm John Kanellopoulos, an eye surgeon based in Athens, Greece, and New York City, New York. It's very saddening as a physician to experience this, and through my career so far, 20 years in academic or private practice, I've always gone with the traditional teachings of maximizing the care you can offer your patients, and it is very unfortunate that we've seen Greece, a member of the European Union, and I'm not going to the political reasons, but just the sequelae of all of a sudden austerity taking away from people basic healthcare benefits and basic healthcare altogether is quite sad. And there's short-term effects that we have all experienced. People not affording care, medications not reaching the state pharmacy, the special committees drawn to approve anti-angiogenic medications for, as you mentioned, AMD patients or diabetic patients, postponing or judging that the patient had enough medication and their age is prohibitive for them to receive more, which basically in plain terms means that your vision is not worth as much. So, you know, these bring not significant medical issues in hand and debate, but humanitarian issues. And what I'm sad more is the long-term effects, the silent effects. Greece, and if I may convey my personal opinion, as a culture, does not carry a very strong preventive medicine consensus. Patients do not plan ahead. So diseases such as diabetes, macular degeneration, glaucoma, keratoconus that require, in my opinion, extensive screening and access, easy access for the whole population, were bad to begin with. And now with all this austerity, we will lose several generations of all the work that has been done in the past to make our intervention patient-friendly. And, you know, like most people in the world, Greeks are proud people, and they will just not go to the ophthalmologist for a few years. And if we consider that this is a Western country with relatively good healthcare, very talented physicians, it is a very sad realization. Even on the level of the country, the financial consequences of this may far surpass all the banking statements that we see and all the deficits that we may see, because we all know that vision, although not a life-threatening problem, carries humongous financial impact to the workforce and to the quality of life of patients. Cataract surgery being, for instance, studied extensively in Europe and the US, and being one of the most beneficial procedures for any country in the world. We're very much saddened. Of course, everybody is doing the best they can. It is fortunate that Greece is one of the countries where family ties are still very strong. And you see a lot of times families pitching in and trying to help a family member. But I'm hoping that we will leave this behind us as soon as possible and go back to working on just making medicine more affordable and more accessible for every Greek patient. And having mentioned that, the problem is exaggerated from the hundreds of thousands of immigrants that flow into Greece, and Greece is overwhelmed at this point. It's been hit by both sides austerity and a humongous refugee immigration, any way you want to call it. But these are thousands of people, hundreds of thousands of people being pumped into the basically state healthcare system. And a lot of them are traumatized, a lot of them carry diseases that need to be taken care of. And this is only an extra burden to the problems that we described and already exist. Well, unfortunately, we found the hard way that late in last June and the first weeks in July, where the banks were basically closed, that this is another thing Greece was not prepared for. So there's no strategy or emergency mechanism to kick in and stratify healthcare, and of course I'm speaking of eye care that I know better, as a not top necessarily, but a high priority among things that do necessitate a lot of trade between Greece and other European countries or international trade. So we had, just for an example, an emergency cornea transplant. Most tissue enters Greece imported from the US or some other European eye banks, and the inability to purchase the tissue from the eye bank. And our application to the mechanism that was just formed the day before was answered 3 weeks later in order to get additional paperwork in. So it's almost it may sound funny to several people. For us, it was more a tragic reality that that particular case was an emergency and needed to be treated right away. Fortunately, logic kicked in, and we're able to have the U.S. eye bank be more flexible with their protocol, and we did fulfill the need for that case. But I'm sure that was not the only case, and I'm sure that eye care is not the only medical emergency cases necessary to be addressed on an everyday basis, 24 hours a day. The same way we keep a backup generator in our office, I think in a similar mode, there has to be a mechanism to address this on a national level. But I think living in the European Union now and seeing all the advance that Europe has made with conformity standards and specifications, in my opinion, it's sad that a authority or a supervising body of addressing these issues for all European countries is not formed yet. So my suggestion would be either through the ESCRS or a broader European body, a task force being formed to address these issues and at best be able to dictate policy, but even on a simple level make suggestions to the leaders of the European Union, and hopefully have these suggestions addressed and being able to avoid something like this in the future, if not only for Greece, but even for another European Union country.